You may have been prescribed hormone replacement therapy, also called HRT or hormone therapy, as your osteoporosis medicine. You may also be taking HRT to relieve menopausal symptoms, so two benefits for you. And if this is the case, you will generally feel better on HRT, even though you can't products, and they come in different forms: tablets, patches, gels and sprays. How to take them will be explained when they're prescribed for you, and most women will find it easy and straightforward. Of course, your HRT might be different to the type in this video. This gives you a general idea and describes one person's experience. Our volunteer Corinne has kindly given us her time to share her story so you can get a feel for what it's like taking HRT.
I'm 52 years old and I have a family history of osteoporosis. I also had anorexia in the past, and in my late 30s I was found to have osteoporosis following an X-ray and subsequent bone density scan. This showed multiple vertebral fractures, and I started taking bisphosphonate tablets. This continued for 5 long years until the time I was told that it might not have been such a good idea for me at my age and in my situation. Very much not ideal. And with 7 spinal fractures, my risk of future fractures is obviously very high, and it's high enough to need drug treatment, especially now that I'm postmenopausal. I don't have estrogen protecting my bones in the same way. I did get some side effects with the bisphosphonates, and I found them very awkward to take. And more recently, I was also having menopausal symptoms, so HRT seemed like a really good option for me.
The hormone estrogen in your HRT is an osteoporosis medicine that makes your bones stronger and reduces your chance of breaking a bone. HRT is safe and effective when it's prescribed in the right way for the women who need it. It can help to prevent osteoporosis in the years around the menopause, and especially if you have an early menopause, when it's used up until the normal menopausal age of around 50. HRT is usually started before the age of 60. As you get older than this, the risks may start to outweigh the benefits. It's important to discuss your own benefits and risks and how long to take it with your doctor so you can decide what's right for you. Women often take it for a number of years as it's safe and an effective medicine. If you stop taking HRT, then talk to your doctor about whether you need another medicine instead. Bones are made up of living tissue. The insides of our bones are constantly being broken down and rebuilt by specialist bone cells. As long as this process is in balance, your bones should stay healthy and strong. But if the process becomes out of balance, our bodies can start to break down more bone tissue than we build. This can cause the bones to become weaker and more likely to break easily. Estrogen works by slowing down the cells that break down bone. This helps to restore the balance and make your bones stronger.
I've been on HRT for around 6 years now, and during that time I've tried various versions from spray to gel and patches. I take both estrogen and progestogen all the time, so I don't get a period at all, but the progestogen protects my womb from a slight increased risk of cancer with the estrogen-only therapy. I've settled with the patches for convenience, as I found the gel took far too long to absorb and it was very sticky and unpleasant. And the spray was very easy to use, but not always easy to find at the pharmacy, which is something that you may want to consider if you're starting on HRT. The patches look like this. Give you a little look, and they're really easy to use. I have a routine around remembering Tuesdays and Fridays as my new patch days, and although I'm not at the stage yet where I need an app or a diary reminder, those are always really helpful prompts for people who need them. Today is a patch day, so I'll show you how it works. After my shower and before putting the patch on, I make sure that the skin on my leg is really dry, and definitely no body lotion either, because that can cause the patch to peel off. And as I showed you, each pack comes in an individual envelope with very clear directions about not putting it too near the chest or abdomen. So I put mine on the outside of my upper thigh, and I alternate legs each time. I take the patch out of the little envelope like this, and then I peel back backing material, and then I just stick the patch on my leg. It's a bit like a plaster, but it's see-through, and then I give it a really firm pat to make sure that it won't come off, for example, if I'm having a shower, and voila, that's it. I have no problems at all with the patch staying in place, and that's why I really like them. It has also been a case of test and learn in terms of the dosage that I need, and that was partly driven by the menopause symptoms, but also because I really wanted to see improvements in my bone density. And I know it's not the perfect way to check bone strength, and it's certainly not essential, but I feel like having a measure of my bone density is the only way that I really know if my osteoporosis is stable or improving. For me, it's been really great to have a medicine that's not only alleviated the menopause symptoms, but also treats the hidden osteoporosis. It also means that I'm managing the condition without needing other medication, which didn't suit me. And so there are no conflicts, and I really feel that my life is a lot simpler too. And I personally don't have any concerns about the long-term health risks. I'm very low risk for breast cancer and heart disease at my age, and I have no problems with my family history in that regard. Luckily, I've had no side effects. And in fact, I've actually experienced better sort of life in terms of mood swings. I get less brain fog, and definitely no night sweats. So truly, it's been a real godsend for me. And as I get older, I recognise that I will need to consider other osteoporosis medication options. But I'm very lucky in that I have regular conversations with a hospital specialist once every 6 months or so, and they monitor my condition. And if I have any concern between times, I can always contact my GP, who's actually the person who prescribes the HRT medication in the right dose. So keeping things simple and manageable for me is absolutely key to being able to stick at any medication program over a long period of time. So I'd always encourage people and the healthcare professionals to keep that in mind. Right now, this feels like the right osteoporosis medication for me. And of course, I'm also following, good lifestyle practices as well, because one day I'll have to come off the HRT, and I want my bones to be in the best possible shape that they can be for when that time comes. So I do weight-bearing exercise, I do impact exercises, and I also do weight training for muscle resistance to build up my bone strength. And combining all of this together feels like I'm taking really positive steps for my osteoporosis and my bone health.